Hi, I'm Mark Beamsley, and I'm the Director of Medical Student Education in our department. I'm here to talk with you today for a few minutes about a new model of student precepting in our clinics that we call the Core Preceptors program. So the model is really pretty simple. The idea is that faculty have the option to become a core preceptor, and if they do that, they work with 2 students in clinic in a half day rather than 1 student. And you have 2 hold spots on your schedule rather than 1 hold spot. So why do we do this? The concept's pretty simple, having 2 students in clinic with you. And historically, our department's had really good feedback from medical students over the years about their experiences learning with you in clinic. Why do we make a change at all? Well, as I mentioned, the first thing we wanted to do is make this an optional model for faculty who are especially interested to take a focus on medical student teaching. We know that faculty in our department have a lot of different interest areas like obstetrics, hospital medicine, nursing facility medicine, sports medicine, the list goes on, but not everyone's as interested in medical student teaching. Some people are, and we wanted to create an opportunity for those people to have a focus, a concentrated opportunity to work with medical students. We also wanted to start to try to address some of the variables that affect the experience for faculty and students in clinics. Things like schedules, faculty development, getting feedback from students and faculty, and patients and staff about how the teaching model works. And lastly, we really wanted to try to affect the family medicine match rate at our institution. Historically, again, we've had really good match rates and good learning experiences in our department, but we know there's an incredible need for primary care physicians not only now, but more in the future. We hope that this model enhances the experiences for you as faculty as well as students, and ultimately can hopefully affect our student match too. Some of the benefits I've mentioned already, but things you see here include the opportunity for students to do peer-to-peer teaching. We take it for granted that students, residents, and fellows work together in the hospital on teams. We can do the same in clinics. Students working together oftentimes have different experiences, levels of learning, and they can teach one another. The Core Preceptors model also allows us to do advanced scheduling. As I mentioned, it allows faculty to opt into this. It's allowed us to build in faculty development with quarterly check-in meetings with the faculty. And one last potential benefit, if you have 2 students working with you in clinic rather than 1, this may help with your note writing at the end of the day. Some of the keys to success for developing this program, we're having a very supportive department chair who's also interested to improve experiences for you as faculty, as well as students, and ultimately to increase the family medicine match. A small but important detail is keeping the model net neutral in terms of costs and the hold spots that are on your clinic schedules. It's also incredibly important that we have a very engaged, large department of faculty members, so lots of people who have potential interest in this. We piloted the program to get feedback from small sample numbers of students and faculty, as well as staff at clinics and patients, to see how that worked before implementing it on a bigger basis. So typically in a year, about half the students in Madison and family medicine will be randomized into the Core Preceptors model, which means about half the students will be in our traditional 1-to-1 model. We use anonymous surveys at the end of their training time in clinic with you to get feedback from them. And we use the same types of questions the medical school uses for students at the end of their clinical rotations. So we're able to compare our model to student learning experiences in other parts of their training. We also did surveys with faculty, clinic staff, and patients. You see here some of the outcomes from the surveying. Staff seemed to find that the model worked well with their clinic day and didn't really disrupt patient flow. Patients also felt that the experience was as good as a typical experience that they might have with you as a faculty member if they had 1 student or no students. And in some cases, they thought that this was an even better experience. Faculty had lots to say about this from the pilots and from the implementation year in 2024. Overall, faculty felt that the advantages of the model outweigh the disadvantages, specifically the learning opportunities we talked about, the scheduling configurations. And faculty felt it did not cause significant disruptions to patient care. The student outcomes I'm really excited to speak about because there was a very clear outcome that students in this model viewed it favorably. We had 7 feedback questions that are based on the normal questions students have during their clinical training at SMPH, and 5 out of those 7 feedback questions were scored higher from students in the core preceptors model compared to our one-to-one model. Some of the quotations you see from students were they felt like they got helpful feedback, it was a good learning experience, and despite the fact that they're in clinic with another student, they felt that they had equal opportunities to practice patient care skills. So in other words, there didn't seem to be competition to do things. I'll wrap it up by saying, if you're interested to be a core preceptor, we do recruitment starting every summer. We'll have announcements to the department, and if you'd like to consider this or if you have any questions, please contact me. Thanks.